Hey guys, welcome to my first educational video. I want to go over a potential adjunct therapy for your male finasteride and HRT patients. I'm going to be talking about 3-beta hydroxysteroid dehydrogenase, or 3-BHSD. It's required for the biosynthesis of all classes of steroid hormones, such as glucocorticoids, mineral corticoids, progesterone, androgens, and estrogens. Essentially, this is the master enzyme associated in hormone synthesis and degradation. When taking exogenous steroids, so these are your HRT clients, or finasteride, 3-beta HSD is inhibited, resulting in a buildup in pregnenolone and a lack of progesterone. This is what we're going to focus primarily on today. So we've prescribed the client HRT or finasteride, and the result is we have a patient with low levels of progesterone. For the finasteride user, we also have inhibited conversion of progesterone to allopregnenolone. This is because progesterone to allopregnenolone is catalyzed by 5-alpha reductase, of which finasteride inhibits. Allopregnenolone is the body's natural GABA A receptor agonist. As I'm sure you guys know, GABA is the chief inhibitory neurotransmitter in the brain. You might also be familiar with other GABA A agonists like Xanax. Unlike Xanax, progesterone and its conversion to allopregnenolone shows no tolerance with daily dosing up to 300 milligrams per day in men. Allopregnenolone is potently pro-libido, anxiolytic, antidepressive, improves sleep latency and sleep architecture, as well as improvements in cognition and memory. What we're going to use is oral micronized progesterone. This is a product we already carry, and I encourage you guys to get familiar with it as an upsell. It's important that we use oral and not topical application due to the concentration of 5-alpha reductase enzymes within the liver. Please see the following graph. Comparing vaginal to oral administration of progesterone. As you can see, there is a marked elevation of allopregnenolone with oral dosing, which is not seen with topical application. I know vaginal doesn't directly translate to topical use, however, this is the only study I could find measuring allopregnenolone and its conversion using different administration routes. However, studies on pregnenolone dosed orally versus topically in men show a similar effect, a marked elevation in allopregnenolone with oral use that did not occur when applied topically. Outside of the potent pro-libido, anxiolytic, antidepressant, and pro-sleep effects of allopregnenolone, progesterone itself also has other beneficial effects for both HRT and finasteride users. Progesterone upregulates a protein known as steroidogenic acute regulatory protein, which are referred to as STAR-D1. STAR-D1's job is to move cholesterol from the outer mitochondrial membrane into the inner membrane, beginning the neurosteroid cascade. STAR-D1 expression is downregulated by a lack of progesterone, of which finasteride and exogenous hormones cause via inhibition of the aforementioned hydroxysteroid dehydrogenase enzyme and FSH suppression, respectively. When STAR-D1 is inhibited, cholesterol is not utilized for normal function and it accumulates. Total cholesterol increases, HDL decreases, and this trend is seen across studies on exogenous hormone and finasteride users alike. As we know, this can lead to heart disease. In finasteride users, oral micronized progesterone will resolve this issue by upregulating STAR-D1 expression, allowing cholesterol to be utilized as normal. In HRT clients, the effect will be moderate due to the lack of FSH. I won't go into a deep dive on that now, but perhaps I'll make a video on cholesterol management for hormone users in the future. The 5-alpha reduced metabolites of progesterone are also potent inhibitors of the mineral corticoid receptors, By antagonizing aldosterone, it's able to improve electrolyte balance, resulting in reduced water retention and therefore a decrease in blood pressure, improving not only the patient's appearance but also their long-term health. So in summary, progesterone is encouraged as an adjunct therapy in HRT and finasteride patients. Not only does it play an important role in libido, sleep, and mood, it also helps lower total cholesterol and prevent low HDL cholesterol. On top of that, it also helps improve electrolyte balance and therefore blood pressure. Now, dosing. Oral intake of progesterone is preferred due to its 5-alpha reduced metabolites. Dosing alongside food is recommended. Studies show a 2-fold increase in bioavailability when taken with food. Dosing before bed is recommended. The GABA-A agonism causes sedation, and we don't want our clients falling asleep during the day. In my experience, male patients have the best results taking 100 to 225 milligrams of oral micronized progesterone with their last meal before bed.